I'm Abby, and I'm presenting on lateral epicondylitis, also known as tennis elbow. Start with the epidemiology. This is a soft tissue condition, usually a chronic overuse injury that is at the origin of the forearm extensors, so the lateral epicondyle. This causes degenerative changes in the tendons and the development of granuloma tissue. And I looked up a little bit about, granulomatosis tissue. I looked up a little bit about that, and basically it's just this tissue that comes in and it causes really bad things to happen, and degeneration, and kind of takes over the place. So again, degeneration of the collagen matrix of the tendon. This occurs in about 1 to 3% of the population, and the degeneration can lead to a tendon lesion or a complete rupture of the tendon. Signs and symptoms are pain at the lateral proximal forearm and lateral epicondyle. The athlete or patient may have decreased grip strength or pain with gripping, which is a big red flag there that it might be lateral epicondylitis. The mechanisms of injury, mostly it's a chronic overuse injury caused by repeated forceful wrist extension, radial deviation, supination, or grasping in an overhead position. For evaluation, history is going to be your most important tool. Their mechanism of injury, their signs and symptoms, that's definitely going to lead you to your diagnosis quicker. You want to look for swelling over the lateral epicondyle or for pain and crepitus. There may be pain with wrist extension, radial deviation, supination, or grasping. And you definitely want to use your special test for lateral epicondylitis. So we're going to talk a little bit about the phases of pain for lateral epicondylitis. The first one is mild pain after exercise activity that resolves within 24 hours. Stage 2 is pain after exercise activity that exceeds 48 hours and resolves with warm-up. Stage 3 is pain with exercise activity that does not alter activity. Stage 5 is pain caused by heavy activities of daily living. 6 is intermittent pain at rest that does not disturb sleep, but the pain is caused by light activities of daily living. And the final stage is constant pain that is often described as dull and achy, and pain that disturbs regular sleep. For treatment, the non-surgical approaches, I looked at some massage techniques. So for that, there is deep broadening, active engagement broadening, deep longitudinal stripping, active engagement lengthening, and deep friction massage. There's no proven most effective treatment for lateral epicondylitis, although NSAIDs, corticosteroid injections, acupuncture, therapeutic exercise, pulse ultrasound, and friction massage are all commonly used to treat. Another thing that I found is the use of platelet-rich plasma injections rather than corticosteroids to try to restart the regeneration and healing. As far as surgical options, most common is an arthroscopic or an open release technique. That I was a little confused about because they talked a lot about how lateral epicondylitis isn't an actual inflammatory disease. It's really more of the tearing and the degeneration of the structures. So I was a little confused as to why you would go in and try to open those structures up if the structures are damaged. So that's just a little something to think about. Are there any questions?